Great, thank you. Let me recognize Mr. Mass from Florida for 5 minutes.
Thank you, Mr. Chairman. I want to take a step back and ask that we all recall we have districts back home, and while we deal with national policy, the questions that we ask on this matter to individuals with children, individuals that go to work, individuals that are exposed to people that travel. We will all travel presumably Friday or Saturday back to our home districts. We're in a very international city here, and I feel as though this sense that I'm getting from you all about quarantine not being the right path does not pass the test of common sense. But I don't want to dwell on that right at this moment. What I want to ask first, number one, in the aim of speaking about people that we represent back home, if you were in Wuhan right now, any one of you, you all have experience with this, what would be your first or second or third line of defense? How would you protect your family? How would you protect yourself? Would you wear a mask? Would you wash your hands? Does that not work? Would you not touch your eyes or your nose? Would you prevent your kids from going to school? What would you do?
Can I start with, I think, and there are many other primary prevention methods. Health education is one. I think if people understand what's going on, and they understand the severity of the issue, and you let them know that how can they protect themselves and their families and their children.
That's the question I asked. If you could answer that for me, it would be fantastic.
That would be, through social media, through any channel we can have.
Social media is not protecting anybody in Wuhan. What do they do to protect themselves? So if there are people that come to our country because there is no quarantine on them because of this academic approach instead of common sense approach, what do people do to protect themselves when they are exposed to others?
I think what confused me about your question initially is the if you were in Wuhan, and I can't speculate, I don't know what the situation is happening in Wuhan. As I mentioned before, one of the great unknowns about this virus is the apparent discrepancy in what we are hearing about in terms of severity and illness in China versus the more close to 150 cases that have been reported outside of China. The majority of the cases that have been reported outside of China have largely been mild disease, like other respiratory illnesses.
I apologize for cutting you off, but none of you are answering a very straightforward question. Mr. Klain, you're presumably the expert on this panel. If you were there at ground zero, maybe you're not in a full-on tap suit, but what would you do if your family was going to be in an area that was exposed to it? How would you protect your family from this? What is defense one?
Yeah, so Congressman, I think this goes back to your initial point, which is defense one would be to get out. And the problem, I think, for this issue of travel bans and quarantines is that probably hundreds of thousands or millions of people have. Okay.
Thank you. Number one, get out.
Right?
Number two, what would you
would be social distancing, would be trying to have fewer interactions with people. You asked about keeping your children home from school. What we found in the past is when that happens, people's children leave the house and go to shopping malls and other places where they have contact with people. So, it's a tricky thing.
How would you physically protect yourself?
The only real way, I think, to physically protect yourself is to try to stay away from other people. I think if you're going to have exposure to other people, as we all do, washing your hands, doing things to minimize the spread of the virus is good. But, get out of where the virus is, stay away from other people, and then engage in standard, public health kind of practices, wash your hands, whatever.
I mean, we don't say whatever. This is a serious question.
Yeah.
Washing your hands might be a simple act, but it's a very serious thing when you're looking at a pandemic like this. Dr. Bowie, one of your last comments that you made was about quarantine perhaps only slowing the transmission. Is there at this point a vaccine?
No.
So would slowing the transmission be a victory?
Well, it's a victory for other cities, other countries.
Is it a victory for the United States of America?
It's a victory for human beings.